welcome to the deep dive. Today we're diving into a world that's often maybe a little mysterious and sometimes maybe even makes people kind of nervous. Gynecologic tests and procedures. But don't worry, this isn't going to be like a boring medical lecture or anything. We're here to uncover the fascinating science and the empowering knowledge, and yeah, even some surprising stories behind these tests that we're talking about. So are you ready to explore this world with me?
Absolutely. I think it's really powerful to understand these tests, not just from like a medical perspective, but from a personal one too. It's about taking charge of your own health and feeling confident about the choices that you make.
Okay, so let's start with something that can be a real roller coaster, pregnancy tests. They seem pretty simple, but did you know that like the earliest pregnancy tests, they actually go all the way back to ancient Egypt?
It's true. They used to soak barley and wheat seeds in a woman's urine. And if the barley sprouted, it meant she was pregnant. Thankfully, we've come a long way since then.
That's amazing. I guess even back then, people were super eager to know if they were going to have a baby. But speaking of modern pregnancy tests, they're not all the same, are they?
You're right. While home pregnancy tests are really convenient, how accurate they are can kind of vary. It depends on the brand and how they're used, and even when in your cycle you take them.
Oh, wow.
So it's really important to follow the instructions, and if you get a positive result, to confirm it with a lab test. That way you can have real peace of mind.
It's like in those movies where someone takes a pregnancy test and you're like waiting to see if that second line shows up. And in real life, that confirmation from a doctor can definitely help with the anxiety or, make the excitement even bigger.
Absolutely. And it's not just about confirming a pregnancy either. These tests are important for keeping track of how the pregnancy is going too. Like early on, doctors might do blood tests to measure a hormone called HCG. That can tell them how well the pregnancy is progressing.
Okay, so we've tackled pregnancy tests. But there's so many other tests out there. Sometimes it feels like doctors are speaking a different language. Like, what's the deal with all these blood and urine tests?
Think of them as windows into your overall health, not just your gynecological health. They can show a lot about what's happening inside your body, sometimes even before you feel any symptoms.
So it's like they're detectives. But instead of magnifying glasses, they're using test tubes and microscopes. What kind of secrets can they uncover?
Well, for one thing, blood tests can measure your hormone levels, which are super important for a bunch of things. From regulating your menstrual cycle to understanding fertility issues. They can also check your red blood cell count to see if you're anemic, which can make you feel tired and weak. And they can check your platelet count to see how well your blood clots are.
It's amazing. Those blood tests are like holding all these tiny clues. That can solve a whole health puzzle. And what about urine tests? They always seem a bit less dramatic than having blood drawn.
Don't underestimate the power of pee. Urine tests are great for finding infections, like UTIs, urinary tract infections. They can also tell us about how your kidneys are working, showing signs of things like dehydration or even bigger kidney problems.
Okay, so we've covered blood and urine tests, but let's get real for a second. Nobody really likes talking about infections, but they're just part of life, and it's important to know how to deal with them.
I totally agree. One of the most common things I hear from patients is about abnormal vaginal discharge.
Yeah.
It can be caused by all sorts of things: bacterial vaginosis, yeast infections, or even STIs, sexually transmitted infections.
Yeah, I think a lot of women experience that at some point, but it can be embarrassing or even scary to talk about it. So what should you do if you notice something's off?
The most important thing is to talk to your doctor. They can take a sample of the discharge and look at it under a microscope, or send it to a lab for testing. This will help them figure out exactly what's causing the problem, so you can get the right treatment. Remember, trying to treat it yourself can sometimes make things worse, so getting a correct diagnosis is really important.
That makes sense. And while we're talking about things that might be a little awkward to discuss, let's talk about STIs. Getting tested for STIs regularly is super important, especially if you're sexually active.
You're absolutely right. A lot of STIs don't have any symptoms, so you might not even know you have one. That's why regular screening is so important, not only for your own health, but also to prevent spreading it to others.
It's like that saying, knowledge is power. The more you know about your sexual health, the better decisions you can make to protect yourself and your partners.
Speaking of knowledge and protection, let's talk about cervical cancer screening. This is a big one, right?
It really is. Cervical cancer is one of the most preventable cancers, thanks to regular screenings like the Pap test and the HPV test. Okay, quick reminder. What are those tests looking for again?
So the pap test, it's sometimes called a pap smear. It involves collecting cells from your cervix and looking at them under a microscope to see
Hmm.
if there are any abnormalities that could maybe turn into cervical cancer. The HPV test checks for the human papillomavirus, or HPV, which is common STI, that can lead to cervical cancer.
Wow, so these tests are like two powerful weapons in the fight against cervical cancer. When should women start getting screened? And how often should they get tested?
Current guidelines say you should start getting pap tests at age 21 and continue getting them regularly. Based on your age and the results of your previous tests, the frequency of HPV testing can vary a bit, so it's important to talk to your doctor about your own risk factors and what kind of screening schedule is best for you.
So it's not a one-size-fits-all thing, which makes sense. Personalized care is really important.
Absolutely. And another thing that's super important is early detection. Cervical cancer often develops slowly, and those precancerous changes can be there for years before cancer actually develops. That's why those regular screenings are so powerful. They let us find those changes early when treatment is most likely to work.
So it's like catching a tiny crack in a bridge before it
Right.
turns into a huge problem. But what happens if your pap test or HPV test comes back abnormal? That's where the colposcopy comes in, right?
Exactly. Colposcopy is where we take a closer look at your cervix using a special magnifying tool called a colposcope. It's kind of like using a magnifying glass to look at a tiny detail. But in this case, we're looking for abnormal areas on your cervix.
So it's a way to zoom in and get more information. Is it a painful procedure?
Most women say it feels similar to a pap test. You might feel some pressure or cramping, but it's generally not considered painful. And the good thing is, if we need to, we can take a biopsy during the colposcopy, which means taking a small sample of tissue to be looked at under a microscope.
So the colposcopy gives us a clearer picture, and the biopsy gives us more definite answers. It's all about getting information so you can make the best decisions about your health. Speaking of getting a clearer picture, let's talk about imaging studies like ultrasounds, MRIs, and CT scans. These tests can be a bit intimidating because they're so high-tech.
I know what you mean. But these imaging studies are really helpful tools. They let us see inside your body without having to do surgery. Each type of imaging uses different technology and has its own strengths and limitations. So we choose the right one based on what we're trying to see and the information we need to get.
Okay, so it's like having a toolbox full of different gadgets, and each one has its own special purpose. Can you give us some examples of how they're used in gynecology?
Absolutely. Ultrasound, especially transvaginal ultrasound, is really common for checking out the reproductive organs. It uses sound waves to make images of the uterus, ovaries, and fallopian tubes. It's often used to diagnose things like uterine fibroids, which are non-cancerous growths in the uterus, or ovarian cysts, which are fluid-filled sacs on the ovaries, and endometriosis, which is when the tissue that's supposed to be inside the uterus grows outside of it.
So it's like sonar for your reproductive system.
Yeah,
And what about MRI and CT scans? They seem a little more intense.
they are a bit more involved. MRI uses strong magnets and radio waves to create very detailed images of the pelvic area. It's particularly helpful for conditions that need a very precise view, like endometriosis or complex ovarian masses. CT scans use X-rays to create images of the body in slices. And while they do involve some radiation exposure, they can be helpful in evaluating if a cancer has spread, or in cases where we need a diagnosis quickly.
It's amazing how those imaging techniques can show us things that used to be hidden. It's like having superpowers. But what about those situations where imaging isn't enough, and a doctor needs to actually go inside and take a closer look?
That's when we might use procedures like dilation and curettage. It's often called a DNC, and hysteroscopy.
Okay, those names sound a little intimidating. Can you break those down for us?
Sure, so in a DNC, the cervix is dilated, which means it's gently widened, and then a curette, which is a small spoon-shaped instrument, is used to remove tissue from the lining of the uterus. This procedure can be used to diagnose and treat different conditions, like abnormal uterine bleeding, polyps, or to manage miscarriages.
So it's a way to both diagnose and treat certain things in the uterus. And what about hysteroscopy?
Hysteroscopy is a procedure where a thin telescope-like instrument, called a hysteroscope, is inserted into the uterus through the vagina. This lets the doctor see the inside of the uterus directly and do things like removing polyps or fibroids, which are non-cancerous tumors in the uterus.
So it's like taking a tiny camera on an expedition inside the uterus. You mentioned earlier that fibroids are non-cancerous, which is good, but can they still cause problems?
They can, yeah. While most fibroids are benign, meaning they're not cancerous, they can sometimes get pretty big. and cause symptoms like heavy periods, pelvic pain, and even problems getting pregnant. So it's really important to find them early and manage them properly.
It's amazing how these procedures can now address issues that would have been really difficult or even impossible to treat in the past. Medical technology has come such a long way. But let's talk about one more procedure, one that often comes with a lot of questions and even some myths: laparoscopy.
Laparoscopy. It's a cool procedure that sometimes gets a bad rap. It's what we call minimally invasive surgery, which means the incisions are smaller and you recover faster compared to traditional open surgery.
Okay, so less pain and scarring, that's definitely a good thing. But how does it actually work?
Basically, we make a small incision, usually near your belly button, and insert a laparoscope, which is a thin tube with a camera on it. This lets the surgeon see your pelvic organs on a video monitor, the uterus, fallopian tubes, and ovaries, and then they can do a whole bunch of different procedures.
So it's like having a miniature operating room inside your abdomen.
Exactly. And it's used for all sorts of things, from diagnosing and treating endometriosis to removing ovarian cysts, or even doing a tubal ligation, which is a permanent form of birth control.
Wow, that's amazing how much can be done through such tiny incisions. I think it's really important to highlight that minimally invasive procedures like laparoscopy often mean less pain, less scarring, and a faster recovery for patients.
You're absolutely right, and that's a huge win for women's healthcare. Welcome back to the deep dive. We're keeping on with our exploration of gynecologic tests and procedures. And this time, I want to look at how some of these tests are used in different situations. Because sometimes it's not just about the test itself, It's about what we're trying to figure out. And the peace of mind that comes with that.
You're right. It's like those medical shows where they order a ton of tests and you're thinking, okay, but what are they looking for? Okay, so let's break down some of those scenarios. We talked a lot about pregnancy tests earlier, and I know those two little lines can bring up a whole bunch of emotions.
Oh, absolutely. Whether you're planning a pregnancy, hoping for one, or totally surprised, those first few weeks can be a whirlwind. Anticipation, anxiety, joy, and sometimes even a little fear, all mixed together. And while those home pregnancy tests are a great first step, it's that confirmation from your doctor that often makes it feel real and helps you figure out what to do next.
It's like that moment when you finally hear the baby's heartbeat. It suddenly becomes so real. But what about when things don't go as planned, like with a miscarriage?
Miscarriage is, unfortunately, more common than people think, and it can be just heartbreaking. In these cases, doctors might use blood tests to check HCG levels, which helps them see if the pregnancy is ending naturally, or if there needs to be some kind of medical intervention. And sometimes a D&C is recommended to remove any tissue that's left in the uterus. It helps with both the physical and emotional healing.
It's so important to remember the emotional side of these experiences. Miscarriage can be a really lonely and isolating thing to go through. And having a doctor who understands and supports you during that time is just so important.
I couldn't agree more. It's not just about the physical, it's about taking care of the whole person emotionally, too.
Now let's switch gears a bit and talk about something that maybe doesn't get talked about enough, but is actually really common: abnormal vaginal discharge. We mentioned it briefly earlier, but I think it deserves a deeper look.
Definitely. It's one of those things that so many women experience, but it can be confusing and even embarrassing to try to figure out what's causing it.
Yeah. Exactly. Is it a yeast infection? Bacterial vaginosis? Something else entirely? And how do you know when you should go to the doctor?
Well, here's the thing. Our vaginas are actually home to a whole community of microorganisms, and the balance of these microbes can change throughout our cycle, and because of different things like stress, diet, even certain medications.
Wait, so our vaginas are like little ecosystems. That's fascinating.
No, it is, and most of the time this ecosystem is balanced and everything's fine, but sometimes that balance gets thrown off, and that's when you might start to have symptoms like unusual discharge, itching, or a different smell.
So like when the bacteria in your gut gets out of whack and you end up with digestive problems, except this is happening in a different part of your body.
Exactly. And just like with your gut, there are things you can do to help keep your vaginal microbiome healthy, like wearing breathable cotton underwear, avoiding douching, and even eating a balanced diet with probiotics.
Okay, so those are great tips for prevention. But what if you're already having symptoms? How do you know when it's time to see a doctor?
It's always a good idea to see your doctor if you notice any big changes in your discharge, especially if you also have itching, burning, or a strong, unpleasant odor. They can take a look at the discharge under a microscope or send it to a lab to figure out what's causing it and recommend the right treatment.
So no more trying to diagnose yourself with Dr. Google. It's best to leave it to the experts. And speaking of expert help, let's go back to cervical cancer screening. We talked about how important regular Pap tests and HPV tests are, but I know those tests can sometimes come back abnormal. What happens then?
Well, first of all, it's super important to remember that an abnormal Pap test or HPV test doesn't automatically mean you have cervical cancer. A lot of times it just means that some cells on your cervix look a little different, and we need to do some more investigating.
So that initial screening is just the first step. What happens next?
If your Pap test shows some abnormal cells, we might do a colposcopy, like we talked about before, that lets us get a closer look at your cervix.
Yeah.
Using a magnifying instrument.
Right, it's like zooming in to see what's going on at the cellular level.
Yeah.
But what if the colposcopy shows something that's worrisome?
In that case, we might need to do a biopsy, which means taking a small sample of tissue from your cervix to be examined under a microscope. This helps us figure out if those abnormal cells are precancerous or cancerous.
Okay, so the biopsy gives us a more definite answer. But what if it comes back positive for precancerous cells? Does that mean you're definitely going to get cervical cancer?
Not at all. Precancerous cells mean they have the potential to become cancerous, but it doesn't mean they will. In a lot of cases, we can treat or remove those cells before they ever have a chance to turn into cancer.
So it's like catching cancer in its earliest stage, when it's much easier to treat.
Exactly. And that's another reason those regular screenings are so important. They give us the chance to intervene early and potentially stop cancer from developing in the first place.
That's such a powerful message. It's not just about finding cancer, it's about preventing it. Now let's change gears again and talk about those times when we need to take a closer look inside. Using imaging studies. We talked about ultrasounds, MRIs, and CT scans before. But I want to focus on ultrasounds for a minute, especially transvaginal ultrasounds.
Transvaginal ultrasounds are incredibly helpful in gynecology because they give us such a clear view of the pelvic organs. We use them a lot to diagnose a bunch of different conditions, from uterine fibroids and ovarian cysts to endometriosis and even ectopic pregnancies.
Okay, remind me what an ectopic pregnancy is again.
An ectopic pregnancy is when the pregnancy happens outside of the uterus, usually in one of the fallopian tubes. It's a serious condition that needs to be treated right away because it can be life-threatening if it's not taken care of.
Wow, that sounds scary. So transvaginal ultrasounds can help find those dangerous situations early on. That's amazing. But what if the ultrasound shows something that needs to be looked at more closely?
That's when we might do a biopsy. And even though we often think of biopsies in relation to cancer, they can actually be used to diagnose all sorts of conditions. For example, we might do a biopsy of the endometrium, which is the lining of the uterus, to help diagnose things like endometriosis or endometrial polyps.
So it's another way to get a clear diagnosis and figure out the best treatment. Now, let's go back to those two procedures we talked about earlier, D&C and hysteroscopy. We covered the basics, but I'm curious about when they might be recommended and what the recovery's like.
Good questions. A D&C might be recommended for different reasons, like abnormal uterine bleeding, miscarriages, or to remove polyps or other tissue from the uterus. It's usually done as an outpatient procedure, which means you can go home the same day. Recovery is typically pretty quick. Most women have some cramping and light bleeding for a few days.
So it's not major surgery, but it's still important to follow your doctor's instructions and rest as much as you need to. And what about hysteroscopy? When is that usually done?
Hysteroscopy is often recommended for women who are having abnormal bleeding, especially if other tests haven't been able to pinpoint the cause. It can also be used to diagnose and treat things like uterine fibroids, polyps, and adhesions, which are bands of scar tissue that can form inside the uterus.
So it's a way to both figure out what's going on and fix it. What's the recovery like for hysteroscopy?
It's usually very similar to a D&C. Most women can go home the same day, and they might have some mild cramping and bleeding for a few days.
Okay, good to know. And lastly, let's wrap up our talk about procedures with one that often has a lot of questions surrounding it and even some misconceptions: laparoscopy.
Laparoscopy, it's a pretty amazing procedure. It's really changed the game for gynecologic surgery. Like we talked about earlier, it's minimally invasive, so the incisions are smaller and you recover faster compared to traditional open surgery.
Right. Less pain, less scarring, and a quicker recovery, count me in. But I know there are still some myths out there about laparoscopy. What are some of the things you hear from patients?
One of the most common things I hear is that laparoscopy isn't as effective as regular surgery. But that's just not true. Laparoscopy is just as effective as open surgery for a lot of conditions, and sometimes it's even better because it's more precise and gives us a clearer view of what we're doing.
So it's not just less invasive, it can also be just as effective. or even more so. That's a win-win.
Exactly. Another misconception I hear is that laparoscopy is only used for minor things, but actually it's used for a wide range of procedures, from taking out ovarian cysts and treating endometriosis to doing hysterectomies and even cancer surgeries.
Wow, I didn't realize it was used for so many things. So it's a pretty powerful tool for gynecologists.
Yeah.
But what about the risks? Are there any specific risks with laparoscopy?
Like any surgery, laparoscopy does have some risks, but they're generally low. The most common ones are bleeding, infection, and damage to nearby organs. But these complications are rare, and the benefits of laparoscopy often outweigh the risks.
So it's important to talk to your doctor about the possible risks and benefits,
Right.
like with any medical procedure. But it's good to know that laparoscopy has a good track record for being safe and effective.
Absolutely. And you know, what I find so amazing about all these tests and procedures is how they empower women to take control of their own health.
I totally agree. Knowing about these tests and procedures, understanding what they involve, and knowing what questions to ask, all of that makes you feel more confident and empowered when it comes to making decisions about your healthcare.
Well said. It's all about being informed and proactive and working together with your doctor to get the best possible outcome.
Welcome back to the deep dive. It's really amazing how much we've covered, from those ancient Egyptian pregnancy tests all the way to cutting-edge laparoscopic surgeries. It's like we've traveled through time and explored what's going on inside the female body. It has been quite a journey. And I think one of the most important things we've learned is that when it comes to your health, knowledge really is power. The more you know about your body and the tests and procedures that are out there, the more confident you'll feel about making decisions about your health care.
Absolutely. It's about being an active participant in your healthcare, not just sitting back and letting things happen.
And speaking of being proactive, I want to go back to something we talked about earlier, the importance of regular checkups and screenings.
Yeah, those routine appointments might not be the most exciting, but they're so important for catching problems early on, when they're usually easier to treat.
It's kind of like taking your car in for regular maintenance. You might not always want to spend the time or money, but it's definitely better than having your car break down on you.
That's such a good analogy. And just like with car maintenance, there's a recommended schedule. For gynecological checkups and screenings, those guidelines can be different depending on your age, your health history, and your family history. So it's always best to talk to your doctor about what's right for you.
So there's no one-size-fits-all approach. It's all about personalized care, which makes sense. But let's get specific for a second. What are some of the key screenings that women should talk to their doctor about?
Well, we've talked a lot about cervical cancer screening, and that's definitely a top priority. The pap test and the HPV tests are so good at finding those precancerous or cancerous changes in the cervix. And finding those changes early is key for successful treatment.
For sure. And while we're talking about preventative screenings, let's not forget about STI screenings.
Oh, right.
They're really important for staying sexually healthy, and they can help prevent serious problems down the line.
You got it. It's important to be open and honest with your doctor about your sexual history. And any concerns you have, they're there to help you stay healthy, not to judge you.
Exactly. And while we're on the topic of screenings, let's not forget about other important parts of women's health, like breast health.
Right. Doing regular breast self-exams and getting mammograms are so important for finding breast cancer early. Your doctor can help you figure out what the recommended screening schedule is, based on your age and risk factors.
So it's all about being proactive and taking charge of your health. And I think it's important to remember that you're not alone in this. You have a whole team of healthcare professionals who are there to support you, answer your questions, and address your concerns.
Couldn't agree more. And you know, it's really incredible how much progress has been made in women's healthcare. We have so much more knowledge, so many more tools, and more options available now than ever before.
It's true. We've come a long way from those ancient Egyptian pregnancy tests.
We definitely have. And I think it's important to celebrate those advancements, but also to recognize that there's still more work to do. We need to keep fighting for research, funding, and access to good quality healthcare for all women.
Well said. And to our listeners, we hope this deep dive has given you some valuable information and helped you understand gynecologic tests and procedures a little better. Remember, your health is your most precious asset, so take good care of it.
Absolutely. And never be afraid to talk to your doctor. If you have any questions or concerns, they're your partners in health.
Great advice. And that wraps up our deep dive into the world of gynecologic tests and procedures. Until next time, stay curious, stay informed, and stay healthy.